Welcome to the Africa Public Health Podcast from Africa CDC, your go-to source for information on key continental health security issues. I am your host, Andisiwe Michelle May. In this series, you will get valuable insights from African scientists and researchers as we unpack important public health topics that impact the continent and the latest developments in public health research. Today, we discuss the importance of capacity building and training to achieve universal public health care on the continent, featuring insights from leading medical doctor and the acting Deputy Director General of the Africa CDC.
My name is Raji Tajudeen, and as acting Deputy Director General, I oversee all the day-to-day programs of the Africa CDC. So I started my career as a medical doctor back home in Nigeria, and I specialize in pediatrics, and I worked at the teaching hospital in northern Nigeria. From there, I went to Saudi Arabia, where I also worked as a pediatric specialist at King Khalid Hospital. Now, why have so much interest in capacity building, learning and development is the fact that I observed that there's a very big gap as far as that space is a concern. Today, if you look at our primary healthcare system, we say that the backbone of any primary healthcare system is the community health workers. We are nowhere near what is needed to drive our primary healthcare system on the continent of Africa of 1.4 billion people. We know that in 2017, our head of state and government did issue a declaration, asking the African Union to work with partners to ensure that we are able to train, recruit, and deploy 2 million community health workers. Today, we are still less than 1 million community health workers on the continent. So meaning that we are say less than 50%, of what we need in terms of community health workforce. So looking at this number, you will agree with me that there's no way you can talk of a strong primary health care that will allow us to achieve universal health care. There's no way we can achieve that when we have less than 50% of what is required in terms of workforce to drive the primary health care delivery system agenda on the continent of Africa.
Thank you, Dr. Taj. To start us off, can you give us some context as to why these gaps exist and what the leading drivers are?
Let me start by saying that as Africa CDC, we have our 2023 to 2027 strategic plan, and we have the so-called strategic priorities, which include surveillance, lab systems, research and development, National Public Health Institute. We also have a local manufacturing agenda, and of course, non-communicable diseases. Now, a cross-cutting enabler for this strategic priority, is the need to have in place best-in-class, fit-for-purpose health workforce at the right number and equitably distributed. This is what we want as Africa CDC. Now, going back to your question, of why we continue to have inadequate number of healthcare workers on the continent, couple of factors. We have poor investment as far as that space is concerned. We are not investing enough as far as the training of our healthcare workers. Number two, we have poor coordination, in terms of the different stakeholders who are working in that space, even in terms of the sectors. You have a situation whereby the Ministries of Health, the Ministry of Finance, the Ministry of Labor and Productivity, the National Planning do not really sit down to coordinate the approach to really training and deployment of these healthcare workers. You also have different partners doing different things at the same time, unnecessary duplication of effort. So poor coordination is also one of the issues here. Number 3 is the lack of political will. Many a times we see investment in health workforce like a cost, and not investment. So until we begin to see, the training and the development of healthcare workers as an investment and not a cost, we'll continue to have a shortage of healthcare workers. I'm sure we are all aware of the so-called brain drain, whereby we train people and before you know it, they leave the continent and go for greener pasture. Again, this also driving, the inadequate workforce that we have on the continent. And the last but not the least is the fact that there is poor incentive as far as the healthcare workers are concerned. So because of that poor incentive, so many people are not interested, or you train people, they end up going to do something different because of poor incentive in that space. So these are some of the factors, driving inadequate or the low number of health workforce as far as the continent is concerned.
Can you speak to some of the initiatives that are in place to help bolster capacity efforts? And is there any focus on programs that are aimed at training the next generation of public health leaders?
So I will share with you a couple of initiatives that Africa CDC has embarked upon, to really support the health workforce agenda as far as the continent of Africa is concerned. So number 1 is primary healthcare workforce. And as part of the primary healthcare workforce, Africa CDC has a robust agenda around community health workforce. In fact, we have given ourselves a target to train 500,000 community health workers between now and 2027, as part of the Africa CDC Strategic Plan 2023 to 2027. And in this space, we are working with partners, including the UNICEF, including the MasterCard Foundation. As part of primary healthcare workforce, we are also training nurses and midwives, to make sure that we get it right as far as the primary healthcare workforce is concerned. Number 2 is master level training. Again, here we support a lot of training at the master level, especially biostatistics, data science, implementation science, and applied epidemiology, at the master degree level. We're working with some of our partners, including the European and Developing Country Clinical Trial Partnership, to train what we call the bolstered fellows. So currently, we're working with 10 different universities spread across the continent of Africa. Still talking of master level training or equivalent, we're working to support our member state to train field epidemiology fellows, So in this particular space, we have supported a couple of our member states to train advanced level field epidemiologists. Number 3 is around leadership and fellowship training program. Here again, we know that there is huge gap when it comes to health or public health leadership as far as the continent is concerned. And in this space, we have what we call the Kofi Annan Global Health Leadership Program. Here, we want to train the next set of leaders who are able to emulate the visionary and the exemplary leadership of Kofi Annan. We want health leaders who are able to lead, who are able to engage, who are able to coordinate, and who are able to manage the day-to-day healthcare needs of our member states. In this particular regard, we've supported a lot of our member states. Today, we talk of around 59 Kofi Annan fellows who have been trained, and we're currently training the 4th cohort of the Kofi Annan Fellows. And as part of our leadership and fellowship training program, we also have the African Epidemic Services, which is the Africa CDC owned program around the training of applied epidemiologists, training of public health informatics fellows, training of lab leadership fellowship program. We're also working with our colleagues within the emergency preparedness and response to train the Public Health Emergency Management Fellowship. These are fellows that are managing the Public Health Emergency Operation Centers across the continent. Africa CDC also support a couple of short courses, that allow us to train people in terms of on-the-job training. And in this situation, we have short courses around how to write grant, how to write a proposal, how to carry out robust surveillance, short training around infection prevention and control, case management of what is happening on the continent in terms of disease outbreak. So there's so many of such short courses that we run through our virtual academy.
I'd like to go back to something that you mentioned regarding the current needs of healthcare practice. What are the key skills and competencies needed that align with the future of public health on the continent?
Let's look at the statistics as far as our continent is concerned, and what is the most pressing need in terms of our workforce. Today, our continent records over 100 disease outbreaks annually. In fact, last year alone, we recorded over 150. So if you look at that, then you will agree with me that we need a lot of applied epidemiologists on the continent, which further underscore the importance of field epidemiology training program at advanced level, intermediate, and frontline. And in the same vein, we also need to strengthen the Africa CDC, African Epidemic Services, which is aimed at training applied epidemiologists, training public health informatics, and the lab leadership. So this is one. We need a lot of data scientists on the continent, because whether we like it or not, data is the oxygen, for any public health initiative or intervention. So we need a lot of data scientists on the continent, and these are critical gaps as far as the continent is concerned. I will also tell you that looking at what we are seeing on the continent, we need a lot of community health workers, because whether we like it or not, every disease outbreak begins and ends in the community. Hence, the need to have more than enough community health workers, on our continent. Our head of state and government have given us the marching order. Train 2 million community health workers so that at the end of the day, for every 500 to 600 people on the continent, you have one community health worker. Today, we are far from that 2 million. We have something, around 900,000. So all I need to be on deck to make sure that we have that number. We get close to that target that has been given to us by our head of state and government. Of course, we know that beyond community health workforce, we also need adequate nurses and midwives to be able to have a very strong primary healthcare system. So this is also another skill set that we need, at that community level to really drive our primary healthcare agenda. Doctors are also needed, in adequate number. So I think for me, given what we have, and the situation we are on the continent of Africa, so these are the sort of skill sets, that we say that are very, very important, and we need to have them. Let me also say that given the current situation in terms of the repeated, recurrent, emerging and re-emerging infectious disease on the continent of Africa, we need to build our local manufacturing capacity for air security commodities. In that space, or in that regard, we need capacity around research and development, and we also need capacity in terms of biomanufacturing.
Let's talk about success stories, because I feel that those are an important part of this conversation. Can you tell us about some of the successful capacity building initiatives or training programs that have had a measurable impact?
When the Ebola outbreak struck West Africa from 2014 to 2016, our field epidemic training program fellows played a crucial role in bringing that outbreak under control. Number two, I will also say that the community health workforce agenda, through our initiative, through our advocacy, has really it gained a lot of attention. And with that attention is we're having a lot of investment in that space to make sure that we have the robust community health workforce in terms of professionalizing, institutionalizing, and appropriately incentivizing the community health workforce. Let me also state that still on the community health workforce, they have been able to support the way we respond to disease and outbreak, especially when it comes to hard to reach area. Still on community health workforce, have been able to support the immunization agenda because they know who has been vaccinated, who has not been vaccinated, and what it takes to really mobilize the community to come forward and get their shot. So these are some of the success stories, that we have recorded, as far as the workforce space is concerned.
You touched on the funding issue, and I would like us to unpack that a bit more. How important are factors such as funding and infrastructure, and what role do they play in shaping the sustainability of these programs?
If you look at the Africa CDC institutional arrangement, the Africa CDC is a specialized technical institution or technical agency within an intergovernmental political institution. So given where we are, we have been able to use our position to make sure that we get the political buy-in, because there is no sustainability without political buy-in. So we've been able to get this agenda, to the tables of our political leadership, on the continent of Africa. And we have also been able to mobilize and coordinate the different actors, talking of donors, talking of funders, to be able to begin to really see investment in the health workforce on the continent, as a priority, because there is no health without workforce, So I think we have been able to do that. We have also been able to work with our member states, for them to be able to optimize the available resources in terms of what it takes to invest in health workforce. And one big agenda for us today is to have in place a very robust health workforce observatory, that will allow us to be able to have a clear idea of what is it out there in terms of a number, in terms of measurement and metrics. And last but not the least, we are also working with the member state to really address this issue of brain drain in a very strategic manner. Also working with the different partners, especially our colleagues at WHO and International Labour Organization.
Changing gears slightly, and I would like to draw out your creative side here. If you could paint a picture for us, what does a bolstered African health system that is running at full capacity look like from your perspective?
For me, health system that is able to withstand any shock is what is required at the community level. And this, you are talking of a primary healthcare system, that is able, to deliver what is needed in terms of essential health services, and also being able, to really, protect the community against any disease outbreak, And in that regard, you are talking of a resilient primary healthcare system. You're also talking of epidemic-ready primary healthcare system. And you are talking of a primary healthcare system that has what it takes to integrate services. You are talking of a primary healthcare that has the right investment in terms of supply chain, in terms of financial resources to be able to manage its day-to-day activity. You are talking of a primary healthcare system that is appropriately staffed, in terms of number and in terms of distribution. You are talking of a primary healthcare system that is appropriately digitized, so that you have the data that is required to really shape, and inform the day-to-day, service delivery system at that level. You are talking of a primary healthcare system, that is able to deliver as far as information sharing is concerned, and of course, course, if you leave the primary care system, you're also talking of a system that is able to respond to the recurrent and repeated health threats, that is facing our continent. As I mentioned, we have over 100 disease outbreaks, per annum, as far as our continent is concerned. So we are looking at a health system that is able to prepare, that is able to respond, that is able to prevent, and that is able to recover, should in case, any of these outbreaks occur. You are talking of a health system that have what it takes in terms of access to medical counter measure, especially things like diagnostics, things like vaccine, things like therapeutics, and other medical products. And last but not the least, for me, is a health system that enjoy the necessary political buy-in at every political level.
Do you have a word of motivation for all the role players who are contributing towards creating this resilient health system and ensuring that we achieve this vision?
Number one is the need for partnership that is respected and action-oriented. As I said, so many stakeholders in that space. What is lacking is proper coordination, collaboration, communication, and cooperation, because that's the only way we ensure optimal utilization of the scarce resources. Number two, domestic financing, domestic resources, because we cannot guarantee our health security through goodwill alone. I think as a continent, we have to look inward, and complement whatever that is coming, from elsewhere, with our own doestic resources. And last but not the least, for me, at every stage, as far as this workforce agenda is concerned, I think we need to make sure that in national priority, that our member states are at the center of it all. So whatever that support we are deploying, let the country be in the lead. Let's ensure that we empower the country, to take the lead and coordinate all the resources that are coming into that space.
Thank you for a fascinating conversation, Dr. Taj. As we come to the end, is there anything else you would like to add?
Health workforce is a big agenda. And there is no health without workforce. And let's see investment in workforce as the way to go. If we get it right, in terms of the health workforce agenda, I think the other pieces, of the building block will also, fall in place. So this is time for us to invest, in health workforce.
Whether you're an expert in the field of public health or simply interested in learning more, the Africa Public Health Podcast is here to serve as a reliable resource for you. Please get in touch at africacdc.org. Until next time, I'm Andisiwe Michelle May. This is a Volume Podcasts production.